Hi friends, uh, it's the first video I'm making for you guys, especially the Rehab Gate members. So without any delay, let's start, and I'll be very precise in this video demonstration. It's going to be a very basic lecture or a description about the ultrasound. If you want to use musculoskeletal ultrasound for your clinical or academic purpose or research purposes, maybe this video is going to help you out. Okay, so let's start with the basic requirements. You need a machine. There are various machines available. You might have seen my presentation in the Rehab Gate. Yeah, there are portable units, and there are the trolley mounted units or console units. So I'm using the console unit right now. My console unit is Hitachi EUB 5500. It's a Japanese machine. I have three probes. In musculoskeletal ultrasound, you need higher frequency probes because you need higher resolution. In other specialities, like in gynecology and other specialities in general surgery or medicine, they don't use high frequency probes most of the time because they want to see the organs. And if you want to see the organs or the deeper structures, you need to have a curvy linear probe, which I'm going to show you right now. So this is the probe that they use. So you can see this is from 2 to 5 megahertz. Let me make it very clear for you guys. So this is from 2 to 5 megahertz, and basically this is a curvy linear. You can see it's the interface or the head of the probe is curved. But if you compare it with the other probe, which we most commonly use, this is called the linear probe. So yeah, you can see from this view that this is the curvy linear. It's curved on top, and this is a linear probe. So we need a linear probe, and we need a higher frequency probes. In our case, I'm using 13 megahertz, which it jumps from 6 to 13 megahertz of frequency. The more the frequency, the higher the frequency, and the less will be the depth of penetration, but the image quality is going to be really very good. Okay, so you have a unit. If you want to buy a unit, always try to go for this linear probe having higher frequencies. Most commonly, anywhere between 7 to 12 megahertz is it's a good unit. Okay, so you need to turn on the unit, and let's discuss the basic modes. On the ultrasound machine, there are a lot of modes available. Like for example, this is called the B or brightness mode, or sometimes people call it as 2D mode because it's a two-dimensional mode. This turns on the color mode. This is for Doppler mode, and in the Doppler we have continuous wave and the pulse wave. And you might have heard about the color Doppler and power Doppler and things like that. So this is all associated with the blood flow in the blood vessels. If you have good anatomy, or if you have good knowledge of anatomy, you can do this scanning, and you can look for any abnormalities in the blood vessels as well. This is for M mode. Most commonly it is used by the cardiologists. They have a different phased array probes for cardiology and for visualizing the lungs as well. This is the body marker, or sometimes known as annotation button, but it's not a mode. Then we have a 3D mode. In my unit, we don't have a 3D function, but yes, there's a 3D. Even nowadays, there is 4D mode also available. This is for ECG function, or some people call it as physio function. Let's talk about the interface of the machine. In almost all the machines, you have this alphanumeric keyboard. You can see this A, B, C. It's very similar to all the keyboards on your laptops and computers. So first we need to create an ID of the patient if you want to scan some patient. So the very first thing that you need to do is turn on the unit and select the probe, what probe you are going to use. So let me show you an example of how the image in curvy linear ultrasound probe, when it is used, is shown, and how the image is shown when you're using a linear frequency probe. So probe. So let's start with the curvy linear probe. I'm just selecting randomly the curvy linear probe and the adult abdomen. Now this is really very simple, guys. Okay, so you see the top of this is curved. So whenever you see this curved portion, it's going to be the curvy linear probe. So let's turn off the light, and maybe it will help you see it more better. Okay, so I'm back. This is when you see an ultrasound image having this on top, you can see, or you can understand that okay, it's the probe that is curvilinear. Now let's switch to the other probe, and it's called the linear one, which we use most of the time, and my default function is musculoskeletal. So I'll just, yeah, I'll just select it, and now see that the top is flat, so it tells us that okay, this is a linear probe. So most of the time we are using the linear probe in musculoskeletal ultrasound, because this we scan the superficial structures like muscles, the tendons, the ligament, the nerves, blood vessels, sometime as just landmark, the bones as landmark, and the ligaments, bursa, and the cartilage as well. So let's discuss the other buttons, and then we'll discuss a few things on the screen. I know the image quality is not very good, but I'll focus it, or maybe I'll edit this video, or in the end I'll add some other description of how we can read the screen. But let's come back to the panel again. So you can see there are few things that you must, as a beginner, understand. I must call them the very important things while you're performing the musculoskeletal ultrasound. First, you need to have a clear understanding of the mode you need to work with. This is the B mode. You can see this is the B mode. Let me focus it. If Yeah, that's the B mode, or you can see this B or 2D mode. So you need to select the mode first thing. Okay, the second thing is the depth that you're working with. So we'll discuss what is meant by depth and how you can change it, because there's a button on the on the ultrasound machine that changes the depth. So there you go. So you can see this is the depth, or yeah, now you can see, and the other one just next to it is the focus. So depth is just for example, if you're moving from superficial to deeper structure, you can increase or decrease the depth. Right now our depth is set at 20 millimeter. I'm sorry, but my camera is mobile's camera is not really very good. Okay, so yeah, so the depth, focus, the mode, and around this mode, this turning the knob in clockwise, it's increasing the gain, and counterclockwise, it's decreasing the gain. So let me recall again: the mode, the gain, the focus, and the depth. So these three are really very important. And the fourth one that we need to, you can say, know about is the frequency. So always try to adjust the frequency. For example, this is ultrasound power in my unit. Let's There you go. So that is ultrasound power. In most of the units you might not have this, but you have what is called as the reference frequency. So that is ultrasound frequency, the working frequency. So higher frequencies, you are getting very good image, but lower frequencies, you are getting a deeper image, a deeper depth. So let's start with how the modes they appear. In black and white mode, or B mode, when I press this one, the unit is going to go to B mode. Right now I press the freeze button. This is really very important, because when you want to stop something, that's when you press the freeze button. Okay, so let me pause it for a second, because I'm making this all by myself. So I'll be using this high frequency probe. I'll place my finger on top of it just to show you how the image appears on musculoskeletal ultrasound in B mode, and I'll show you the screen. Okay. Okay, I've just applied the gel, and you can see this is because the sound wave is passing through the ultrasound gel, and it's the returning waves, they are creating this image. You can see I have placed this ultrasound gel, right? So this is simply black and white mode, or 2D mode, and we will be working with this mode while performing musculoskeletal ultrasounds. Uh, I don't think so that we have left any important function, but yes, there are a few functions that you should know. So these are called TGC, time gain compensation. So if you move them to the right, they'll make the screen or the returning echoes more, and the screen will appear more bright. Then this is the arrow, and this is your mouse you're going to work with. These are the calipers. These are the caliper keys. You can make measurements, like you can measure the tissue thickness, or you can measure the diameter or area or things like that. And this is for probe selection. This is for saving the or storing the image. This is ID manager. So if I'm going to create a new ID, I'll press the ID manager, and there you go. So you'll have this form. So you'll click the new patient, and then you enter all the data. I'm not going to do this, so I'll just escape it. Okay, so let's read the screen, what the screen is telling us. I'll try to discuss from here to here, from here to here, and all the way down. Okay, so let's zoom to one region of interest. Okay, so I'll try to make it, yeah. Okay, so it's telling us Hitachi. This is the company name. FR stands for frame rate. Max Rehab is my hospital name. G8, yeah. And let's come to mid. So PH stands for, P stands for power, H stands for high, and MI stands for mechanical index. This ultrasound is producing the same mechanical and thermal effects, but it's 1/10 as compared to the therapeutic ultrasound used by the therapists. This is date and time, but this is really very important. Yeah, this mark is important. This is called the probe marker, and the probe marker tells you where you should point the probe marker. On every probe there is this marker, you see. So the marker needs to be on the same side. In my case, you can see this is the marker right now. Can you see? Yeah, this is the marker. My thumb is on top of it, so the marker needs to be on this side. If let me turn it to the other side. Okay, by pressing 4, see, it moved there. Okay, in the bigger picture, see again. So the image is reversed. So it's just the American and European system. I don't believe in so just work as you think, as you feel comfortable. But right now it's on the right side, so you need to orient the probe towards the patient, right? And if you want to scan like this, and then this marker is going to be towards the patient's head or top of the ceiling. Okay, so let's come down, and these fine lines, these markers, they are telling us about the depth. So we are working at 20 millimeter of, so that's 20 millimeter, and we can count all these lines, 1 2 3 4, and all the way up. So there will be 20 lines. This line having these dots will be 1 2 3 4 5 6, and so these will be these TGC lines. So let me show you. If I move the TGC and unfreeze the image, see, the area will become more bright, and I'll decrease the TGC, and the area is becoming more. So you can say it's just the returning echoes that the machine changes. Then we have the function and the depth. The musculoskeletal ultrasound, we are working at 20 millimeter of depth, and 13 m is the 13 megahertz, the frequency of the ultrasound. 54 m is basically the linear 54 m probe. Brightness gain is at 18, which is 50%. In my machine you can go as high as 35. Now the other mode is called the color mode. So when I press this one, it's not working because the freeze is on. So I unfreeze the unit, and I press the power button, so the color button, and you can see this line appears. If I press the B mode again, it will go back to the black and white mode, and there will be no color. And on the color mode, there is this color, but this is called the color Doppler. But in the color Doppler, you have either the continuous wave or the pulse wave. So you need to select this one. This is called the power Doppler, and so there's this one continuous wave or pulse wave. Let's freeze it, go back to the basic menu, and so you can see, you can select an area of the blood vessel and see whether it's an artery or a vein, whatever it is. uh, then we have this motion mode over here. We can press M mode, and it tells us that if something is moving or not. So it's not also not important for the physical therapist. It's important for the cardiologist and the respiratory maybe therapist or pulmonologist as well. So these are the modes, and in the next video I'll be talking about how to scan different tissues. The basic concept, I must say again, the basic concept should be that you should be able to understand or recognize how the structures they appear in the ultrasound. If you have an understanding of how the structures they appear on ultrasound, and if you have an ultrasound unit, you can work very well, because it's really very easy. You must have a sound anatomy, knowledge of anatomy or human anatomy, and there are different guidelines available that tells you how to place the probe. I know I have skipped a lot of things, but there are few things that I should tell you right now. The darker portion are called as hypoechoic. Hypo stands for less, hypoechoic. So ultrasound is all based on the echoes, the returning echoes, the sound that is produced by the transducer when it is received back by the transducer. That is basically the echo. So or that is ultrasound's working principle. So the darker things will be hypoechoic and the brighter things will be hyperechoic, and completely pitch black will be anechoic. So there will be no reflection. Anechoic, like for example there's a fluid and things like that. You can find it in my lectures as well. But there are different shades of gray. So we call hyperechoic or hypoechoic as compare when we compare one tissue with another tissue. For example, in this image, let me show you the cursor. Where is, yeah, here it is. So this portion is, and even this portion is, it's this one, these are just jet black, and these are anechoic because there is no returning of the sound wave. And here is the maximum returning of the sound wave. This is hyperechoic, and as compared to this region, the under regions are hypoechoic, and even these are hypoechoic. So these are also hypoechoic. So you need to have a basic understanding of what the anatomical structures you're about to see, how it appears on the ultrasound, and where it lies in the body. So it will be really very easy for you guys. I'll share with you the other videos as well. I would really love to see your feedback, because I'm trying the level best to help you out, because it's really very difficult to make videos like this. I'm holding the cell phone in my hand and making this video for you guys. I hope you'll understand it. If you have any questions, you can ask me. If you have any other request, right now I'm working on upper extremity. So if you want to ask me anything about upper extremity, the ultrasound image of the upper extremity, or how to locate or how to follow a structure in ultrasound, you can do a lot of things with ultrasound. It's really very good, it's really very interesting, and it's really very promising. So if you work well, if you pay attention, and if you spend some time on it, you'll learn it. It's really very interesting. And thank you very much. Have a blessed day. Allah Hafiz.